After a long gap, we are restarting the sessions on Economic Survey of India. But this week, within next 2 days, we'll finish all the remaining chapters of Volume 1. So the first 4 chapters are already there on YouTube. Please watch it. The notes also are available in the description. The 5th chapter is something that we'll be starting today. The chapter has been named Healthcare Takes Center Stage Finally. That is, because of Covid-19 crisis, now healthcare is something on which the focus of government would increase finally. Okay, so this chapter starts with why healthcare is important and says that healthcare is not only important from the perspective of providing good health services to people, but it's also crucial for economy. If you're looking at economic growth, even then healthcare is crucial. Why is it so? If I'll be healthy, I'll be more economically productive. If I'll be healthy, I'll have a longer life and thus longer productive life. If I'm not healthy, by the time I turn 50, 60, I'll stop teaching. But if I'm healthy, even at the age of 80, I may be teaching. So my contribution to India's economy would be much higher. And then if I'm healthy, if the good health facilities are available, then the cost of illness, that is when I fall sick, the cost of treatment that is spent would also not be spent in the economy. That would also be something that will be good for overall economy. That money can be used for investment somewhere else. So these are some reasons which they give for why even for economic growth, economic development, health sector is crucial. In fact, Economic Survey of India also quotes WHO, where according to a study by WHO, if life expectancy improves by from 50 to 70 years, like India's life expectancy is roughly 70 years right now. If life expectancy improves this much, then GDP growth rate can go up by 1.4 points per year, 1.4 percentage points per year, meaning every year your growth would be higher than this amount. This is again showing how even for economic growth, the good quality health sector, perfect health services are crucial. In the introduction, the survey also says that public health expenditure is very crucial in order to provide good health services. It's saying that it has compared the health expenditure, public health expenditure in various countries, and has found a pattern that in the countries where public health expenditure is higher or per capita public health expenditure is higher, their life expectancy is also higher. That is, life expectancy and public health expenditure are positively related. Similarly, maternal mortality and public health expenditure will be negatively correlated. If in a country public health expenditure is high, maternal mortality is low. There are these kind of correlations which through Economic Survey of India found, showing that we need to improve or increase public health expenditure in order to provide good health services. Other than this, it also says that public health expenditure can play a very important role in reducing out-of-pocket expenditure. What is out-of-pocket expenditure? Like when I go visit a health facility, some services may be free, but for some services I may have to pay. So right now in India, out-of-pocket expenditures are very high. Economic Survey of India says that if we can increase our public health expenditure, right now India's public health expenditure is around 1% of its GDP. If we can increase it to 3% of the GDP, in that situation, what would happen? Out-of-pocket expenditure will reduce drastically from around 60% to 30%. So even for this, like out-of-pocket expenditure or huge out-of-pocket expenditure in health sector is a major reason because of which a lot of lower middle class families fall into poverty trap. A lot of people who are already poor further deteriorates their condition. You may have seen various examples around you that in treatment of some person in the family, 1 lakh, 2 lakh, 5 lakh was spent. And then this whole family gets into debt trap and keeps falling into that trap. So the idea is we have to reduce out of pocket expenditure. And here Economic Survey of India is saying that if you can increase your public health expenditure to around 3% of the GDP, this could be achieved. This drastic reduction could be achieved. Okay, so these are certain things which Economic Survey of India have talked about in introduction of this chapter. That is the welfare of citizens of any country also depends on its quality of health services they get. Quality of health services is not only important for social welfare, but it's also important for economic welfare. And while providing quality of health service, public health expenditure, that is government's health expenditure, will play a crucial role. Now, let's go to next section. Given significant market failures, healthcare needs system design. Now, please understand, here the focus is on market failures. That is not focus not on market failures. In this section, Economic Survey of India is trying to say that market method will not work in the health sector. That is, health sector cannot function efficiently, optimally, just based on demand and supply. More patients are there, more doctors would be there, competition will increase, quality of service will increase, the cost would go down. In health sector, this doesn't work. In normal market economy, this may work, but Economic Survey of India will show that this market economy wala mechanism is not suitable for health sector. I'm directly coming to the conclusion before getting into the details, but try to understand what is Economic Survey of India trying to emphasize on in this section. Given significant market failures, so here first we'll show that what are the reasons that health sector will not be able to function optimally on market-based approach. Healthcare needs careful system design. That is, because market method is not suitable, we'll have to create a new system of healthcare. New design of healthcare has to be there. A new design of healthcare system has to be there, which will be more efficient. Do you understand what are we going to study in this section? Once you have a broad framework, no, understanding various dimensions would be easier. Now, why are we saying that health sector cannot organize itself based on market forces? Isn't it logical that if there would be more demand for health services, more hospitals would be created, more competition would happen? Isn't it logical? Yes, it's logical, but the health sector is different from normal market economy in a number of ways. First, there is a lot of uncertainty or variability in demand. Uncertainty and variability, think of from a family's perspective. There may be 5 years in a row where I would not need to go to a doctor, no one in my family may need to go to a doctor, but all of a sudden, the cost that we'll have to bear may be equivalent to our whole year's income. That variability, that is from the perspective of individual, but even from the perspective of demand, look at COVID-19. The COVID-19 crisis increased the demand for health sector. So market economy had not kept us prepared for that. So there's a lot of uncertainty. The market mechanism will not be able to cater to that. Second, there is information asymmetry. Now, what is meant by information asymmetry? Now see, in case of other sectors, for example, let's say agriculture sector, or for example, let's say manufacturing sector or other service sector, you know that when you're buying wheat, its value is this much. But in health sector, when you visit a doctor charges you 1,000 rupees. Sometimes you feel that The doctor charged me 1,000 rupees, but I was in pain since last 2 days. He gave me right medicine and I was treated well. Sometimes you feel that why the hell does he charge this 1,000 rupees for 5 minutes? This kind of confusion you have on certain occasions, but this is a small confusion. Think of this: someone who's going for surgeries, big surgeries, where doctor may only be doing a small thing, but charges maybe 5 lakh rupees, 6 lakh rupees. Or forget that. Consider this: someone is going for preventive treatment. Before a disease occurs, preventive treatment. They're evaluating the value of service. You may have got that disease, you may not have got that disease. You were taking preventive steps. So evaluation of value of the service that you are getting is not possible. This is only one type of information asymmetry. We'll look at many other types of information asymmetry, but do you understand? The first thing we said, that market-based mechanism may not be possible in the healthcare sector. One, because there's uncertainty or variability in demand, and huge uncertainties and variability. Uncertainty and variability is there in economy as well, but in healthcare sector, it can be huge. It can be very, very variable. But there is information asymmetry. I do not understand the value. Further, you would see that this information asymmetry also comes from the fact that these days, reimbursement rates are prefixed by insurance companies. In that case, what happens is, like, if someone would come for this kind of treatment, insurance company can pay up to 20,000 rupees for this. Now, in this case, what hospitals do is, this person's bill should be 20,000 crore rupees. Rather than charging the person for the value of service that that person is consuming, the charge is prefixed based on insurance company and hospitals deal. Similarly, there is advertising. Like, I prefer to go to hospitals which are more popular. So this also, rather than paying for the value of the product, I may end up paying unnecessary amounts. Rather than paying for just the service I'm getting, I may end up paying unnecessary amounts. Then there are some private incentives for testing also. You go to hospitals, doctors recommend you a lot of tests which may not be required. So because of information asymmetry, you would take which was not required. Again, unnecessary value. So generally, in case of the first problem that we had discussed was variability. Variability in demand. In case of variability in demand, insurance plays a very important role. But here, insurance is also creating problems. In healthcare sector, insurance is also creating problems. For difficult situations, for accidental conditions, you keep insurance. But health insurance in itself has become problematic. Okay, then health insurance is also creating some uncertainty, variability, and is leading to information problems because of other reasons too. Now, there are two reasons, two broad areas because of which I'm saying that uncertainty or information problems is being created in healthcare sectors. One is ex ante moral hazard. What is ex ante moral hazard? That is, before you get any disease, when you get that disease, health insurance would cover it. But before you get any disease, you do not take steps to prevent the disease. You feel like insurance hai hamara, so you go for this is called ex ante moral hazard. Because of insurance coverage, there is less incentive to avoid poor behavior. Can you understand why this would happen? Then there is ex post moral hazard. What is ex post moral hazard? Ex post moral hazard is this: that after I get disease, and I'm admitted to the hospital, rather than just taking the service which I require, I would go and say, give me the best possible room that you have. This is after you've got the disease. So ex ante, before you get it, you're not taking preventive measures. Ex post is after you get it, you tend to cost, charge, or you tend to use services unnecessarily. So this is another problem because of which we are saying that market-based model is not effective. Three reasons. The information asymmetry wala second reason. Isme one more reason for why this mechanism may not be suitable. And then there is hyperbolic tendencies. The third reason why market-based mechanism may not be suitable for health sector is hyperbolic tendencies. You understand the meaning of hyperbolic? Hyperbolic tendencies are those tendencies by which you are not being careful. So you know that fast food is harmful for your health. You know that soft drinks are dangerous for your health. You know that without mask, if you're roaming around, it's risky. You know all these things, but still you do not take steps to prevent it. So chances of you getting disease would become higher. This is hyperbolic tendencies. It's not only hyperbolic tendencies, not only this, it's also like in Delhi, it has been seen that after someone gets symptom of TB, on an average, a person takes 5 months to reach the DOT center where TB treatment could start. Similarly, you would see that in India, of women aged between 15 and 49, only 22% of them go for cervical cancer screening, or only 22% of Indian women in this age group are given screening for cervical cancer. Only around 10% are given screening for breast cancer. Whereas in other countries, in OECD advanced countries, this percentage is 60-60, 60 to 59%. So this is again hyperbolic tendency. When that cancer would become more difficult to treat, to take care of, then we would want treatment, whereas preventive steps could have been taken. So another reason why market-based system may not be that effective. Three reasons we spoke about why market failures are there in the health sector. Market-based models may not be suitable. Now come to how do we solve these problems? See, the problem of moral hazard in insurance sector could be solved by what is known as incomplete insurance. Incomplete insurance, something like 70% of the money would be paid by insurance company, but you will have to pay 30% of the money. In that case, what happens? Because I'll also have to bear 30% of the cost of this particular thing, I will choose the optimal solution rather than going for excessive expenditure. But that only deals with the insurance wala issue. Overall, because market-based system is not functioning, is not optimal in this scenario, generally it is recommended all over the world, healthcare sectors, wherever they are functioning properly, they are functioning or they are structured as oligopolies purchasing from oligopsonies instead of individual consumers purchasing from individual providers. What is meant by this? So oligopolies or oligopsonies basically mean that there are small number of buyers and there are small number of sellers. तो सर्विस देने वाले कम हैं बट बहुत सारे बड़े प्लेयर्स हैं. Service people who are buying service, they are also less, but they are big players. For example, group insurance. So an organization will get all their 100 employees insured, or under Ayushman Bharat. What happened? Government of India is getting citizens of the country insured. Insurance done. Generally, it has been seen that this kind of model is more effective in the healthcare sector, where market-based model has still continued, but market-based model where individuals are buying services from individual hospitals may not be suitable, may not be effective. Okay, now what we have to understand is, according to the survey, we not only have to provide good health services, we not only have to provide increased public health expenditure, but we also have to look at the structure of the industry. Health sector is also in a way, though it's service sector, social sector, but how that sector is structured would be important. Individuals buying services from individuals may not be suitable. It may be suitable in a market-based model, but in health sector, the market, a number of reasons for market failures exist, and thus it may not be suitable there. Okay, now another section of Economic Survey of India is, should COVID-19 impact India's healthcare policy? COVID-19, because of COVID-19, should we start focusing a lot on communicable diseases? Should we prepare infrastructure which should be ready for this kind of crisis in coming future? Should we create infrastructure so that all the hospitals in the country, all the big hospitals in the country should have beds with ventilators available? The Economic Survey of India says that no. These kind of big events sometimes leave what is known as saliency bias. Saliency bias is because of some recent event, you have biased your whole program according to that. But Economic Survey of India says that no, we should not be doing that. Why? First, because this pandemic, COVID-19 kind of pandemic, is a very rare event. It's not something that is happening every year. It was a once in a century event. Second, even now, 65% of deaths in India are being caused by non-communicable diseases. So, increasing focus on communicable diseases, increasing focus on COVID-19 kind of diseases at the cost of non-communicable diseases should not happen. The saliency bias should not come. Then, between 1996 and 2016, the contribution of non-communicable diseases in death has increased. So what we are saying is, it is NCD, non-communicable diseases, whose contribution in overall deaths in the country, and thus contribution in overall diseases in the country, is going up. So it cannot be ignored just because of COVID-19. Further, to prevent communicable diseases, we also have to take care of things like providing cleanliness, sanitation services, drinking water. So saliency bias, that is focusing only on communicable diseases, should not negatively impact Swachh Bharat Abhiyan or Har Ghar Nal Se Jal kind of scheme. This COVID-19 should not be impacting that. And finally, Economic Survey of India also gives an interesting study. It says that even if we had prepared very well for COVID-19, our health infrastructure was very good, let's say like that of United Kingdom or USA. COVID-19 showed that even the well-prepared ones, better infrastructure ones, did not do well. They were among the worst sufferers. They had highest number of deaths. So preparing for this at the cost of reforms in other sectors may not be the right way forward. We should keep our health sector agile in nature, and we should continue with the reforms in overall health improvement that we have been working towards. Fine. Is this clear? So this saliency bias should not be allowed to impact the overall way in which we are functioning. Okay, now some issues with India's health sector in the current scenario is also being discussed by the survey. One is quality and access of healthcare in India. when it comes to quality of healthcare in India, a survey says that though the quality has improved, in fact, if we look at the healthcare access and quality, India's score has improved from 24.7 in 1990 to 41.2 in 2016. In general, it has improved, but even now, when compared to low and middle income economies, low and middle income countries, we are not doing good. So though in last 25 years, the quality of service has gone up, but even now health outcomes are poor. In fact, when we compare ourselves with countries like China, Bangladesh, Bhutan, Cambodia, they have improved much more. Our IMR, though has improved a lot, is still 32 per 1000 live births. IMR is infant mortality rate, children who die before the age of 1. So the 32 per 1000 live is still there. Similarly, MMR is 145 per 1 lakh live birth, maternal mortality rate is still pretty high, though we have improved a lot. So health outcomes are still poor in the country. Similarly, when it comes to access and utilization, like access to health facilities and utilization of health facilities, we are not doing very well. Now, how did survey measure it? How does survey measure it? Survey says that in India, hospitalization rate is 3 to 4%. That is, if you fall sick, what are the chances that if you visit the hospital, what are the chances that you will get hospitalized? It's 3 to 4%, whereas in middle income countries, it is 8 to 9%. In OECD countries, it is 13 to 17%. Clearly showing that even now, the access to health facilities are lower in the country because you don't get hospitalized because you do not have the services. So access and utilization, maybe we are not very amazing. When it comes to out of pocket expenses, India is amongst the worst in the world. Worst. I mean, we'll look at a ranking where India is ranked 179 out of 189 countries. We are this bad. Look at the various regions of the world. Population which spend more than 10% of their income on health expenditure. In India, there is 17% such population. Globally, 13% of the world's population spend more than 10% of it on this, but in India, it's 17%. Population with expenditure on health more than 25% of the income. In India, it is 4%. Again, very high. In fact, even in African region, the out-of-pocket expenditure is very low. In India, this number is very high. And because this is, as I was saying in the beginning, a major factor for increasing cases of people falling below poverty line because of health is happening in the country. Now, inequity still persists. Inequity is like how easily, like if health sector is available, if AIMS is available, how easily will it be? How easy will it be for a poor person to get admitted there and for a rich to get admitted there? Okay, equality is like that is available to both of them, but in reality, what is the scenario? So here we are saying that though decreasing in recent years, inequity is decreasing in recent years, but it still persists. Inequity is still there. Now, why am I saying it's decreasing in recent years? Earlier, public sector healthcares were more pro-rich. Public sector healthcare were more used by rich people. But now, even poorer people's percentage of using public sector healthcare is improving. The percentage of poorest using prenatal care, institutional deliveries, inpatient care, outpatient care has increased. In fact, there's a table here. If you would see the difference between 2004 and 2018 when it comes to inpatient care, earlier the richest people, 29.2% were using it, but their percentage has decreased to 26.4%. But for poorest, this percentage has increased from 12.7% usage to 18.5%. You'll see that for poor people, the percentage of poor people using this has gone up. See, percentage of poorest using prenatal care, institutional deliveries, inpatient care, outpatient care has increased. At the same time, both inpatient and outpatient utilization among the richest has dropped. तो आप देखेंगे inpatient and outpatient care among richest. The second one is for richest. So among the richest between 2004 and 2018, look here, between 2004 and 2018, both inpatient and outpatient care in public health sector, they getting that services from public health sector has gone down. So we are saying that inequity is still there. Even now, the richer ones are using it more. But because richest one के population कम है, वो ज़्यादा है, so even if less number of them are using it, higher percentage of them are using it. But this difference is reducing. Then low budget allocation for health sector. It is a low budget allocation. We are ranked very poorly. We are 179th out of 189 countries in terms of budget allocation as a percentage of our GDP. Not overall. Overall, our budget would not be that big because our economy that small because our economy is one of the largest in the world. But when it comes to budgetary contribution in terms of percentage of GDP, India is amongst the worst in the world, 179 out of 189 countries. This shows that our focus on health sector is not there. In fact, our prioritization of health, how much value we give to health, is similar to donor dependent countries, the countries which are surviving because of donations that they are getting from other countries like Haiti and all those things. Haiti, Sudan, these are the countries which are donor dependent. वो भी अपने जीडीपी का उतना ही परसेंटेज हेल्थ में लगाते हैं रफली जितना इंडिया लगा रही है. That is one major concern. India's health sector budgetary contribution is much lesser, and this includes both central and state budget combined together. Plus, the state expenditure across state is also highly variable. जो स्टेट हेल्थ पे स्पेंड करता है, that is very variable. If you look at health expenditure per capita with increasing GSDP per capita, gross state SDP, on x-axis we have GSDP rising. On y-axis, we have how much are they spending in health sector. So here you will see that states like Karnataka, Gujarat, Haryana, they have high gross state domestic product per capita. They have high GSDP per capita, but their health expenditure is on the lower side. Delhi is a good example. It has high GSDP as well as high per capita health expenditure. But it's not like the states which have high GSDP per capita are spending more on health. Similarly, as a percentage of GSDP, this actually reverses. We would assume no. As the GSDP per capita of states increase, their expenditure on health will increase. But their expenditure on health as a percentage of their GSDP is actually going down. Clearly showing that with improvement in GDP, our focus on health is not that much. Right now, a lot of us may feel that the states are not able to spend because they may not be having money. But here we are showing that with improvement in the money that they get, with improvement in the overall production, with improvement in the per capita production in the state, the expenses are going down as a percentage of their GDP. So you'll see Bihar, though, has very less GSDP. As a percentage of their GSDP, it's spending very high. Haryana, though very large GSDP, as a percentage of their health expense, it's spending very low. So not only the health expenditure in India is very low, among the worst in the world, in states there is variability, and this variability is on the bad side. Bad side, like you are deteriorating every year. With increase in GSDP, you are deteriorating. Now, one more. So what are we looking at right now? We are looking at health situation in India. We first talk about the health output. So we said that India's MMR, IMR, though have improved, but it's still poor. We talked about accessibility. We talked about government expenditure. Now we're talking about human resource. Another key problem which India's health sector suffers from is low human resource. Why am I saying that? According to WHO, generally the places which have high number of people, high percentage of population which is working in health sector, they provide good health facilities. So this is a good indication. If you have trained workforce in the health sector, if you have enough number of doctors, the health facilities in country would generally be good. This is what WHO says. WHO also says that aggregate density of health workers should be around 44.5 per 10,000 population. And there should be an adequate skill mix. Like this 44.5, not all of them have to be doctors. Some doctors, some other person to help doctor. So this mix should be there. But out of 10,000 population, 44.5 health workers should be there. Even in bad scenario, there should be 23 health workers per 10,000 people to ensure that at least 80% of the deliveries are taking place in institutions. What is the situation in India? This is what ideally is required. But what is the situation in India? We are, जो वर्ष वाला तरीका है ना, वर्ष वाला level है, we are at that level. So India's human resource for health density is close to the lower threshold of 23. So you may still feel, oh, we are at least reaching lower threshold. WHO is saying that we are reach 23 lower threshold. But again, this is highly variable among states. If you'll go to India, ka average 23 hai, but most of the states are in a very bad condition. There are very few states which are above that threshold, lower threshold. There's only one state, Kerala, which is beyond what WHO has recommended. WHO has said that 45, 44 per 10,000, 45 health workers per 10,000 population should be there. There's only one state, Kerala, which has 65 health workers per 10,000 population. No state has that. Even when we look at lower threshold, most of the states, Jharkhand, Bihar, Odisha, Rajasthan, Himachal, Madhya Pradesh, Maharashtra, GDP wise, Maharashtra is the biggest state in the country. Karnataka, Gujarat, Chhattisgarh, Haryana, Punjab, they're all missing that level. And then judicious mix of nurse, midwives, doctors is also missing. So see, if in mains examination you are asked a question, discuss the key challenges faced by India's health sector. Can you write these 4-5 dimensions with clear data also? This would be useful then. Now, we have understood so far what we have understood. We have understood that health sector is crucial. We have also understood that health sector cannot be left to develop based on market demand and supply, because there are various problems there. Then we spoke about COVID-19 should not be becoming or creating a saliency bias in our health programs. And then we have looked at what are the key challenges which are there in our health sector. Now, because there are significant market failures. Because there are significant market failures, what should be done? So, pehle let's understand that because of significant market failures, the private sector hospitals are providing suboptimal service. First, we'll have to show that. What is suboptimal service? Suboptimal service is this. You are charging high, but quality of your service is low. You're charging higher than government hospitals. Private sector do that. But is the quality of service there better? This is what Economic Survey of India shows, that quality of service is not better in private sector. And they're charging higher, and that's why right now the structure is suboptimal. How are they saying that the quality of service is not good? Before we get into quality of service is not good, also remember one thing, that even now 74% of outpatient care and 65% of hospital care in urban India is provided by private sector. So if we have to improve the health facilities in the country, we'll have to improve the functioning of private sector. We have to make them more efficient rather than suboptimal they are right now. Now, how are they suboptimal? Why are we saying that they're suboptimal? First, quality of service. Is quality of service poor there? Economic Survey of India says that yes, it is worse than government sector. Why is it saying it? It is using one metric for poor services, that is unplanned readmission. Once I go to a hospital, and there is one planned readmission. I went to hospital, then surgery ka first phase, surgery ka second phase, then readmission would happen. That's okay. But unplanned readmissions kitne ho rahe? That tells you the kind of service that you got earlier. Because it was unplanned, the doctors could not predict that you will get bad. And in unplanned services, generally it has been seen that cost is higher, the time that you spend in hospital is higher, and that's why these unplanned readmissions are considered a metric for poor quality. And they show that these unplanned readmissions in same hospitals are higher in private sector. If you are going for readmissions, 70% of the time, you'll go to the same private hospital for readmission, unplanned readmission. Please remember, I'm talking about unplanned, not readmission. Readmission can be normal also. Unplanned readmission indicates the poor quality. So, through this indicator, Economic Survey of India is saying that the private sector may not be significantly better than public sector. It's not significantly better, but is it more expensive? So yes, Economic Survey of India says that it's much more expensive. The price difference, especially huge in case of severe illness such as cancers, cardio injuries, gastro, respiratory. In all these, in these surgeries, the prices are, in case of cancer, the price is almost 4 times. In case of cardio related treatment, the price is almost 7 times. In private sector, for the cost of treatment, the price is almost 7 times. What does it say? That market-based model is functioning suboptimally right now. So what should be done? System is suboptimal. See, by the way, getting out of Economic Survey of India for once. Economic Survey of India is showing here that in social sector, in one of the social sector, market-based approach is not functioning. Market-based approach is a failure. But again, due to ideological bias of the government, it would not recommend promote more public sector. I'm right now I'm getting a bit diverted from what is being discussed in Economic Survey of India. Can you understand this? They have clearly said that private sector is not effective. Let's create more public sector hospitals. Let's do all these things. Through a corollary, they could have said that we need to create more government colleges. Because even in social sector, private may not be that effective. But all those things have not been discussed. So you may ignore it, but you have to understand that sometimes these government documents, Economic Survey of India and all, may also be propagating one particular ideology which may be good. Again, I'm not criticizing the ideology. It may actually be good. Promoting more market-based approach may actually be something good. Okay, let's come back to this. Come back to what should be the way forward. Way forward in the current scenario when A lot of asymmetries exist when the quality in private sector is poor, when the cost in private sector is high. What should be done? So first recommendation that the Economic Survey of India gives is we need to create an agency which assesses the quality of healthcare providers, quality of both doctors and hospitals. In London's National Health Services, ये 9 यहाँ गलती से लिखा हुआ है. In London's National Health Services, they have a quality and outcome framework. In London, bolo. In UK's National Health Services, they have a quality and outcome framework, which assesses the quality of hospitals. This kind of framework we also need to come up. A body which will say this hospital is rated this much, this hospital is rated this much, this doctor is of this good quality, this doctor is of this bad quality. It will, information asymmetry hai na, will deal with information asymmetry. Then when I look for hospital, okay, this is rated a better hospital, I may go there, because the value of service we do not know, we are not very much aware of. Then information utilities have to be created. Now, what are these information utilities? What is its purpose? See, information utilities should have information related to patients. What patients? That this person has suffered these diseases in the past, this person is vulnerable to this person has faced these many road accidents. In general, what would this lead to is, when insurance company is providing me insurance, a person like, let's say I'm a very badmaas person, and there's a younger brother of mine who's very nice, who's a gentleman, who drives car properly, who takes care of health. Insurance charges for him should not be very high, because there is less chances that this person would be getting ill. So this information utilities should be able to contribute in this manner in dealing with the asymmetries, information asymmetries that exist. And then we also need what is known as sectoral regulator. Healthcare sector mein we need a regulator to undertake regulation and supervision of healthcare sector. Right now, this regulator at only regulator level is not available. Medical Council of India is there, but it's not able to function that effectively. Okay, now we have been saying that information asymmetry exists even in insurance sector. This is clearly indicated by analysis of Economic Survey of India. This figure roughly will tell you why we are saying that information asymmetry exists in private insurance companies in healthcare. What is this figure here? It's basically mapping per capita premium with per capita claim amount. If I'm paying a premium of 10,000 rupees, in general, how much is the claim amount that I'm able to take? So this is private insurer for government sponsored scheme. This is private insurer for group insurance business, and this is private insurance for individual family business. This is public sector, and this is standalone health insurers. Three different types of health insurance are there, providing services to three different group of people. In general, what you see is, with increase in premium, the claim amount is also increasing in general. But come here, private sector, private insurance, in case of group insurance business, with increase in premium, the with increase in premium, the premium amount is decreasing. Why is it possible? It's possible because information asymmetry that we have been talking about exists. Right? Insurance companies is ending up charging more from people whose chances of getting disease is lesser. That's why उनका क्या नहीं होता, claim amount नहीं होता. These are some concerns which ESI has raised. Then a survey also talks about significance of telemedicine in India's health sector. It says that especially after COVID-19 pandemic, the reach of telemedicine, the access to telemedicine has gone up. This is visible from eSanjeevani OPD. eSanjeevani OPD is an online mechanism by which you can consult doctors online. Through eSanjeevani OPD, almost 1 million consultation has happened from April 2020. So eSanjeevani OPD was launched in April 2020. From then, almost 1 million consultation has occurred. Similarly, Practo, you must have used Practo once or twice. 500 has seen 500% increase during COVID-19 or after COVID-19 pandemic. So telemedicine penetration is increasing. Now, the use of telemedicine depends on two things. One is health infrastructure. How many doctors you actually have available, whether they can connect through, whether hospitals can connect through these apps and all. But other is internet penetration. How many people are there using internet? So it has generally been seen that Economic Survey of India has also did this study here. It shows that the penetration of telemedicine is directly proportional to internet penetration, and therefore it recommends that both state governments and central government should increase their focus on ensuring internet services throughout the country. Okay, so these were the different dimensions of this chapter. India ke health sector, how COVID-19 would impact it. Can market-based mechanism be itself effective? If not, how it should be structured differently? This is something that has been summarized in conclusion and way forward also. It says that saliency bias should not happen. Continue focusing on our long-term healthcare priorities. Healthcare infrastructure should be made agile to deal with any unprecedented event. Then we also need to increase public health expenditure from 1% right now to 2.5 to 3%. This will reduce out-of-pocket expenditure by 65 out-of-pocket expenditure, which is 65% right now, to 30%. Then there's also a need to deal with information asymmetry in private sector. For that and for improving the overall quality, there is focus on sectoral regulator. There is focus on how information utilities can play an important role here. How data from National Digital Health Mission. So where would information utilities get their data? They can get this data from National Digital Health Mission while remaining in bound of privacy laws, privacy provisions. How all these things could be used to deal with information asymmetry. Then insurance sector, maybe information asymmetry exists, how it should be dealt with. We have also talked about that. And finally, they also say that National Health Mission has contributed heavily in reducing inequity in the health sector. That focus should continue in collaboration with Ayushman Bharat. And at last, telemedicine. Telemedicine can make health sector more accessible. Telemedicine can make health sector reach remote areas of the country. So it's recommending that both central and state government need to invest in telemedicine on a mission mode to complement the government's digital health mission and thereby enable greater access to masses. Okay, so this was chapter 5 of Economic Survey of India. In the next class, we'll be dealing with chapter 6.